Hi, this is Caleb Jarosh, licensed acupuncturist. Welcome back. In this episode, I'm going to be talking about fatigue because in my clinic, I see a lot of fatigue. And what I'm going to be speaking about specifically is how to differentiate between the different patterns of fatigue. And this channel is for acupuncturist professionals who are wanting more information specifically around pulse diagnosis, Chinese pulse diagnosis, and how to use the herbs in relationship with the pulse. So to jump right in, fatigue, like I said, I see it a lot. You probably see it in your clinic a lot too. When I first started practicing years ago, I was told that a lot of the fatigue that was going to show up in my practice was due from more of like this one cause, and that was kind of a spleen qi deficiency or qi deficiency in general. So what I found is that's actually not true. It's a very, very small percentage of people that come to me that I actually end up treating for that kind of qi deficiency or spleen qi deficiency. It's about 10% of my total patient base, even though a lot of people come to see me for fatigue. And I'm going to talk a little bit about the other three patterns that really you don't hear about much and that you probably didn't learn about in school. So again, about 10% of folks I'm treating with for, the typical kind of depletion, qi depletion. So another pattern, the first pattern that I want to talk about other than that one, and because, when we're talking about fatigue, it shows up all the way, all populations from teenagers, not so much in kids, but teenagers all the way through the 20s, 30s, 40s, 50s, all the way up, right? And so the next kind of pattern that I want to talk about, it's more than 10%, it's about 15%, and it really depends on your population, is a kind of a kidney deficiency. Now this can definitely show up in younger populations, surprisingly, just due to, I think, really our culture. So you might see this in your clinic, but it definitely shows up in older populations, so 60 and above. And this is about maybe 15%. Like I said, it'll depend on if, the majority of people coming to your clinic are in that age bracket, then you'll probably have more of this. But a kind of a kidney deficiency, and it could have, usually it has a yin and it has a yang aspect to it. So it has this both. That it's really important, obviously, to differentiate because it's going to be completely different herbs. Now, the next pattern that you probably wouldn't have guessed is actually related to the liver. And this could be either deficiency in the liver that's affecting the actual the production of energy in the body. Lots of different conversions that happen, conjugations that happen in the liver, all the way from the thyroid all the way through to digestion. So the liver, I've found, really plays a huge part when it comes to fatigue. It can be upwards of sometimes 40%, 50% of the people that are having fatigue are coming, a cause of it is actually liver dysfunction. Now this could be a deficiency or an excess. And the last one that I want to talk about is actually heart, and it's related to cardiovascular disease, which is a huge problem in the United States. It's the #1 killer of people in the United States at this point. So this can happen from a deficiency, but what I see more of, and I would say it's the majority of people in my clinic, more than the liver patterns, is congested heart or a blocked heart. So the blood's not getting pumped through the vascular system efficiently or effectively. And this by far, I would say, would be probably the #1, the largest cause or pattern that's going to be showing up. And what's wonderful is that, if you know how to read the pulse, this will actually show up in the pulse and you won't have to guess, you won't have to do. I know when I first started practicing, I didn't really know how to read the pulse, and so I was doing a lot of stuff off of symptomology. And the problem with that is it's not very effective. If you're doing that, you probably understand it already. Symptomology, maybe you'll get 50%, maybe 60% effectiveness in treating, because really it's a guessing game. And we know in this medicine that one symptom could be caused by several different problems in the organ systems, right? So to be able to really figure out and access and know exactly which organ system is causing the problem is going to save you a ton of time, because you don't always have a lot of time with your patients. Usually what I notice is that if they're not feeling better within 3 weeks to 4 weeks, then they're gonna drop out. And that's because Chinese medicine, it's not really part of our culture, and so people aren't trained and educated about it. And so you really have to be spot on. And what I typically notice is within, it can be quick, within about 5 days. Usually it takes about a week or 2 weeks. Patients will feel about 30% better in their symptoms. That's kind of what I shoot for. It's what we shoot for at the clinic. That's totally possible. So I hope this is helpful for you. Just to give you a little bit a broader idea of how to differentiate, how to use the pulse, and in more videos I talk more about specifics of the pulse, but I'm not going to go into that in this video. I just wanted to talk about the patterns. Thanks so much for joining me, and we'll talk to you soon.